Thank you so much to all of you tuning in. We'll just give a few seconds as folks are joining. I am really excited to do this. I know we didn't have much of an advance warning for everybody across Scarborough Southwest. But here we are because we know how important it is to make sure that people have information available. And we were getting a lot of questions throughout the past few days. And as my team tries to get back to you with responses, we thought, well, you know what, let's have an emergency session, information session, so we could actually, take some of your questions and answer them, and not just myself, but with some experts. Just let me start by saying welcome to you all. I'm Dolly Begum, your MPP for Scarborough Southwest, and I am so excited to have today with me Dr. Joyce Zhang, who is an internal medicine and occupational medicine physician. She has a previous background in pharmacy. She also has a research interest in clinical epidemiology, workplace impairment, and drug detection, health information, and technology development. Welcome, Dr. Zhang. I also have with me David Baluz. And did I pronounce that right, David? Perfect. David is the chief. Is the chief for strategic partnership and public health engagement with Scarborough Health Network. And I have to say, one of the people who has been with us for the past weeks and months, actually more than months now, helping us with all the information, making sure that we can do our job, keeping all of you informed. David is one of these people, and we're so thankful to David for that, and to the entire team of Scarborough Health Network for the work that they are doing, to the entire healthcare team, to all of you out there, all our caregivers in every parts of this province. We are so grateful, and Scarborough Health Network has been a great team that's from the beginning of this pandemic, doing as best as they can with the limited amount of resources in the best way possible. And especially as we face this sort of vaccine rollout period, with all of the shortcomings, I think Scarborough Health Network has been doing an amazing job, working really hard day and night to make sure that our community gets vaccinated. So thank you so much to both of you for joining me today. Without further ado, I won't take too much time. I'm just going to pass it on and hand off to David and Dr. Zhang to do some introduction and give us an overview of the current efforts, because we just this week got all our information about vaccination.
Thank you so much, MPP Begum, and thank you so much for hosting this town hall. We are very excited to be here today to share some information with you, to let you know about what's happening right now in Scarborough and where we're going with vaccinations. So at first, I want to talk about a little bit about the current state that we have here right now in Scarborough and in the GTA. So the highest number of COVID cases during both waves of the pandemic has been in Scarborough and Peel. The map that you're looking on your left is the latest map from Toronto Public Health as to where you see communities that have a higher prevalence of COVID-19, and those are the ones in the darker areas. And as you can see, Scarborough is in those darker areas. The cases in Scarborough are now decreasing, and a higher number are still being seen in the West End and in North York, but we're not taking our eye off the radar and seeing what's going on right now. And hospitalizations have also decreased in Ontario and in Scarborough. But we do know that with the onset of the new variant of concerns that are out there, that we might still see another spike. A little that we want to talk about is the vaccination clinic, because I know that a lot of people have some questions about that and where can they get vaccinated. So Scarborough Health Network will have 5 vaccination clinics running in Scarborough. Currently, right now, we have our Centennial College Progress Campus vaccination clinic that is open and is accepting patients by appointment only, and our Centenary Hospital. When we're ready to fully be running, we will have that as well as Taibu, the hub with Scarborough Center for Healthy Communities, Care First, and a number of mobile vaccination clinics. And what I mean by mobile vaccination clinics is we're going to basically take the vaccine clinic and go into community institutions, retirement homes, places where we know that there might be people that are living together that are of an advanced age, and host the vaccine clinics there. And we're going to be doing that in partnership with the Toronto Paramedic Service and with Michael Garron Hospital. The main question that everybody has right now is how they can register for the vaccination. So who are the two groups that Scarborough Health Network and our Scarborough partners are bringing together for the for vaccination? The first group is the highest and very high priority healthcare worker. And if you're a healthcare worker and you want to know if you are in those two groups, you can visit scarbvaccine.ca, and there's a link there that will provide you with the information if you do fall within those two categories. Also, for our residents that are 80 plus and that they live and reside in Scarborough, we are now taking registrations, again, at scarbvaccine.ca, for you to book your appointment at one of our two clinics right now. At our two clinics also, we can, when we are able to get to be fully operational at our Centennial Clinic, we'll be able to do up to 2,000 shots a day. And at our Centenary Clinic, we'll be able to do about 800 shots a day. We launched a pilot. It was only this Monday that we launched our pilot, and it was quite successful. We yesterday vaccinated about 1,200 individuals, and today we had 20 stations going full steam ahead. So we're going to be vaccinating as long as we have vaccines. This is something that's really interesting because I know that there's a lot of questions with regards to the sequencing and when am I going to be able to get a vaccine, or what category do I fall into? This is a very helpful slide, and we'll provide it as well to MPP Begum, which really shows the current state of what the province is planning for the rollout of individuals for vaccinations. And so where we are right now, we are doing the 80 plus population, our homeless and Indigenous population. And right now, as of, well, I believe that was yesterday, if you are between 60 and 64, you can register either with a family physician or with a pharmacy that is participating to get the AstraZeneca vaccine. Now with that, I'm gonna pass it over to my colleague, Dr. Joy Zhang, who will talk a little bit about vaccinations. And after that, we'll be more than happy to take your questions. Dr. Zhang, over to you.
Thank you, David. And thank you so much for having me. It is showing that my internet connection is unstable, so please let me know if at any time my audio is cut off. So the next few slides, I'm just going to be talking a little bit about vaccinations and hopefully address some of the questions that people might have about the vaccines available that we have for COVID-19. We know that vaccines have been around for decades. It is perhaps one of the biggest advances that we have in modern science in eliminating millions of infections every year. And because of the advance in vaccination science, we were able to eliminate some of the once very deadly infections in the past. Next slides, please. So in terms of the COVID-19 vaccines, there are currently 4 vaccines that are approved in Canada. The Pfizer and the Moderna vaccines are both mRNA vaccines, which I'll get into in the next slide about how they work. And we have also the AstraZeneca as well as the Johnson & Johnson vaccines, which are viral vector vaccines. Whenever we think about vaccines, in a lot of the media coverage, they talk about vaccine efficacy. For example, the Pfizer and the Moderna vaccines are quoted to have an efficacy up to 95%. But what does that actually mean? Well, efficacy is how well it works in a clinical study, while effectiveness is how well it works in real life. And it's really effectiveness of the vaccine that is more important, because it actually tells us how well it's working in protecting the individuals in our population. Now, we know that in countries with very high vaccination rates, such as Israel, the number of COVID cases have dropped significantly since they ramped up their massive vaccine campaign. And that is a real life evidence to support the effectiveness of these tools that we have. We know that these vaccines are able to decrease symptoms in people who contract COVID, as well as decrease the percentage of people who require hospitalization. The Pfizer and Moderna vaccines are both 2-dose vaccines administered 21 days to 28 days apart based on the trial data. Next slide, please. Like I said earlier, they're both mRNA vaccines. And mRNA technology is a technology that has been around for a long time. But these happens to be the first time we've utilized them in a vaccine format. All it is a recipe for the human body to create a protein that's a replica of a protein on the virus. Then our body is able to make an army of antibodies and cells that specifically target this type of protein. So when you're exposed actually to COVID-19 virus, your body is able to quickly recognize this protein and thus eliminating the whole virus. Next slide, please. The AstraZeneca vaccine and the Johnson & Johnson vaccines are viral vector vaccines, which means that they actually use a inactivated, dead, modified virus to carry in this genetic instruction, which is a little bit different than the mRNA vaccine, which does not have the viral factor. So this is the second last vaccine that was approved by Health Canada. However, it is the latest vaccine that we do have available in Canada. The Johnson & Johnson vaccine is not expected to arrive in Canada until April 2021. As of now, it is suggested by our national guidance to be used for those under the age of 65. This recommendation was made because in the trial, most of the patients were a little bit younger. A lot of people have raised concerns about this quoted efficacy of the vaccine being lower than the Pfizer and the Moderna vaccine. The efficacy of the AstraZeneca vaccine is quoted around 62%. But like I said earlier, efficacy does not necessarily translate into effectiveness and how well it works in the real world. We actually have information to support that AstraZeneca vaccine are overall almost 100% protective against serious or severe COVID-19 disease that will require hospitalization, severe disease, and death. And that is the most important piece of information I want you to take away in case you had questions about this decreased efficacy that's being quoted in the media. We know that COVID-19 disease has a huge range of how people will experience it. Some people will be completely asymptomatic, have no symptoms. Some people will experience it as a cold. And then on the other end of the extreme, people might require hospitalization, intubation, or may die. And that is the spectrum that we're most concerned about in protecting our population. Next slide, please.
Oh, Joyce, those were all the slides. We're good to go to questions.
Oh, okay. I thought there was one more slide, but okay, so that's all the slides.
We're looking forward and we're really excited to answering all your questions and helping clarify whatever we can.
Thank you so much. Thank you, Dr. Zhang. That was a great presentation. Did you want to wrap up anything, Dr. Zhang, before we go into questions?
Happy to go into questions.
Perfect. Okay. So what we'll do is, and for folks who are joining in, I know there's a lot of people that have joined us on Facebook, I believe, as well as on YouTube. So thank you very much. If you have questions, please put them on the comment section and we will try our best, I promise, to get to as many questions as possible. I also want to thank everyone who sent their questions in advance. We will try to go through those first, and then we'll hit well, we'll try to get through as many questions as possible. So let me actually just go to Maisha, who's helping me in the back end to start giving us some of the questions so that we can address them.
Great. So I will start with, there's a lot of information right now out about the AstraZeneca vaccine. So we received a question that the AstraZeneca vaccine is recommended for ages 64 and under. My understanding is that it has an efficacy of 63.09%. My husband is 64 years old and would like the Pfizer or Moderna vaccine. Should he wait till that is available?
I'll pass that off to Dr. Zhang.
I think I've already addressed it in my presentation about that quoted efficacy does not translate into effectiveness. And we don't have head-to-head information to say how much better the Pfizer or the Moderna vaccine is against the AstraZeneca vaccine in the real world, because all we have are efficacy data that's coming out of the trials. From a medical community perspective, our advice is to get the first vaccine that you're able to receive. We don't know how long you may have to wait, and it is an individualized choice. If you do choose to wait, we don't know how long that will take with all the potential unknowns.
Our next question is, my dad has Alzheimer's and cannot leave the house. He's in his 80s. What is being done to help those who cannot leave the house to get the vaccine?
I could take this one. So for the latest information that we have is that folks who are receiving and community members that are receiving home and community care support will be getting contacted by their provider for that home and community care support to schedule vaccinations. I know it's something that the Central East LHIN is working on right now on the process for that. So I would expect that people that are in those situations should expect to hear hopefully soon.
Great, thank you, David. The next one is, I'm an adult Métis citizen living in Scarborough Southwest and have been notified by the Métis Nation of Ontario that I am eligible for the vaccination. Can I register now for that in Scarborough, or do I pre-register or wait for another phase?
So you can register right now at scarbvaccine.ca, and you should be able to register there.
Amazing, thank you. We have our next question, which is, why has the GTA been shortchanged and not received an equitable distribution of the vaccine based on the number of hospitals, hospital workers, and those in nursing homes? Personal support workers, number of seniors, those with health conditions living in the community, and why is Scarborough ignored further?
I'll take that one. Thank you, Maisha. And I know this is something that people have been writing to our office about as well. I'm sure this is an issue that's, I think for myself and for Peel specifically, this is a huge point, and we will be fighting for equitable distribution of vaccines. Right now, as you know, the hospital itself does not decide how many they get, nor does the City of Toronto or Toronto Public Health. It is actually the province that prioritizes the different areas that are getting the different amount of vaccines. And that's how, and then obviously the Scarborough Health Network, for example, will get their dosage. Right now we've asked, and just yesterday I was asking the Minister of Health, Christine Elliott, for more vaccines to be distributed to Scarborough so that we can make sure that our community that's been hit really badly by COVID gets the amount of vaccines that we need. We'll continue fighting for that. There is a petition that we have online that you can sign to support us in terms of this fight. And obviously, if you want to share your story about why you think that we need to have equitable vaccines in our community, please feel free to share your story.
Great. Our next one is, I'm considered an essential service, working as a physiotherapist, and I'm in direct contact with clients on a daily basis. I want to know what the plan is for my situation.
So what I would recommend is that they check out the website for the list of who falls on what healthcare workers or essential workers fall under the highest and very high priority. We also on our website at shn.ca on the vaccine page, we do have a one-pager that sort of breaks down for people where they fall in terms of that highest, very high priority group range. I apologize. I don't recall off the top of my head where physiotherapists would fall in that.
Okay, great. How long is the wait? So there are 3 questions in this one. How long is the wait for the vaccine for health compromised people? I believe you've addressed some of that. When will the second dose be administered? And is there a 4-month wait for the second dose? So I think this question is a little more around just like the length of the series from the first one to the second one.
I can.
So depending.
I was sorry. I was going to say I'm going to pass that over to Dr. Joyce.
So, I mean, depending on which vaccine you're talking about, the time frame between the first and the second dose based on the trial data ranges between 21 to 28 days. Well, know that the Johnson & Johnson vaccine is a 1-dose vaccine, so this question would not apply to that vaccine specifically. We do have ministry guidance based on NACI, which are national body that makes recommendations about vaccinations, so specifically the COVID-19 vaccination, that there will be a 4-month delay for the second dose. Understandably, there's a lot of questions about what does that mean? Do we have the data to support this approach? As of now, the only country that has adopted this approach, I believe, is in the UK. And we're waiting for NACI to come out with some more information to support this recommendation. There is some evidence from AstraZeneca, because in their original trial, there were people whose 2 doses were spaced more than 12 weeks apart, and it still seems quite effective. But I don't believe I have seen similar studies being published on the other 2 vaccines yet. But we're following the guidance that's been given to us. So right now, yes, there is a 4-month delay between the 2 doses.
Thank you. Our next question is from one of our Facebook comments from Alan, who has inquired about the SHN site for making appointments because it was down at 8 a.m., even though it was supposed to be open at 9, and had gone down again at 9:15 because all the appointments were gone. Why are there not more appointments available?
So thank you for the question. Yes, I do believe at 8 a.m. this morning our system was down for a little bit, but I do know that it is back up, and it was back up later in the morning. Sorry, can you repeat the second part of the question?
Yeah, for sure. Why are there not more appointments available?
So that goes to what MPP Begum was talking about. We're opening up appointments as we get vaccinations. So the more vaccinations we get, the more appointments will open. The more vaccinations we get, the more clinics will open.
Okay, great. Thank you. Our next question is, can both people in a household who both have health issues, 55 and 25, get vaccines at the same time, since they both fall under the health issues definition? What proof do we need to bring? Do we need to bring doctor's notes or medication that we take?
I don't believe we have the specifics for that yet, as based on the framework that David had shared from the province. We have not moved there yet for people with chronic health conditions. So we really don't have any specific information as to which health conditions and what you need to bring and where you'll be getting it. Not at this point.
And I'll just add on to Dr. Zhang's comment. We've created a guide, kind of putting all the resources that we're receiving from different ends together, and it's on our website. And the website is it's just dollybegum.ca/vaccine SSW, and we'll actually put that on our comments on our Facebook as well. you can find updated locations and information, so including SHN, as well as other pharmacies and other locations that are coming forward, as well as the priorities as the province highlights them. We will make sure that we post those as well for you. And I'm sure David will let us know when SHN gets them so that we can update based on SHN information as well.
Thank you. The next question is, I'm interested in taking the plant-based vaccine currently in phase 2. Will I have access to this product? Will my family doctor have the Johnson & Johnson vaccine?
Well, so currently we only have those 4 vaccines that are approved by Health Canada. If whether or not there will be more vaccines being approved by Health Canada and subsequently made available is unclear at this point. The Johnson & Johnson vaccines are not expected to arrive in Canada until April. We're also not sure which types of vaccines the family physician's office will have access to. From the latest news release, it seems that they will be getting access to the AstraZeneca vaccine, but we haven't heard anything about the Johnson & Johnson vaccine yet.
Okay. I see today, this was submitted on Wednesday, I see today the government is authorizing selected pharmacies to vaccinate people between 60 and 65 years of age. When will the opportunities for those of us between 65 and 85 be available?
So I would refer back to the phasing chart that I had provided. That's sort of where the list is right now. But I would just say that the best thing you can do is to keep looking out at informed sources and sources that you trust to get the latest information, because as we all know, these things keep changing quite frequently. So it's important that the answer right now might not be the answer on that next week.
Okay. Are we able to choose which vaccine we get? I have a severe respiratory issue. One of the vaccines says that you will get a cold, but for me that turns into pneumonia. I would like to be able to choose which vaccine I get.
Dr. Zhang?
I don't know. It's a difficult question. Like I said, you always have the choice to see if you say you're eligible for AstraZeneca today, but you want to wait until you get it from your family doctor's office. They might be carrying a different types of vaccine. You always have some latitude, but I just don't know if will be that much choice in terms of choosing which brand to get, because a lot of this is based on availability and access.
I need to know why both my parents did not get appointments when they registered.
Oh, well, that's not supposed to happen. So if your parents did register for the Scarborough vaccine clinics and they didn't get a confirmation email or anything, I would recommend emailing communications@shn.ca, and they'll help you figure it out. You should have received an email that would have given you access to the registration link if you had pre-registered.
So actually, David, do you want to give us kind of the process that people should expect when they go into the link, so that folks who are watching can understand this is what they are expecting, and if not, then they can contact communications.
That's a great idea. Thank you so much for that. I think that so where we are right now is, again, with that whole, a lot of things are changing a lot. Last week, we had launched a pre-registration page, and then a couple days later, we got rid of the pre-registration page and we made it a registration page as vaccine supply had increased for the hospital. We wanted to get them into arms as quickly as possible. So right now, the registration page is still up on that website. You can go there and you can register for the appointments that are open. If there are no appointments open, my recommendation would be to just check back on that website frequently. We are opening slots all the time as soon as things become available. I also know that the province is supposed to be opening up on Monday the central registration link in the central registration site. That will make ours, we're not going to be using ours anymore. We're going to be going through the province, and every Toronto hospital will be doing that as well, from my understanding. So hopefully that'll be an easier process. But until that point, our system is going to be up and running and keeping it updated. Really hourly, we keep it updated with appointments.
Thank you, David. How many people per day will SHN be able to vaccinate per day? Will the hospital and Centennial College use Pfizer or Moderna and not AstraZeneca vaccines?
So right now, for all of the vaccine clinics that I had mentioned, our capacity when we're running at full steam is 35,000 vaccines a day. And that doesn't even include our mobile vaccine clinic, which we would be able to send out and do a pop-up clinic in a location in the community. That is our goal, is to be at that point. We're not there right now, since we only have 2 of our vaccine sites open. But like I said, we've been planning for this for months, and as soon as we get those vaccine supplies, we'll be in a position to open up more of those clinics.
Can you alleviate concerns around the extended timeline for second doses, when in reality there isn't any real world data at this point in time to draw on, nor has Pfizer or Moderna stated that 4 months is an acceptable timeline for second dose?
Can you repeat that for us?
Of course I can. Can you alleviate concerns around the extended timeline for second doses, when in reality there isn't any real world data at this point in time to draw on? Neither has Pfizer nor Moderna stated that 4 months is an acceptable timeline for second dose.
So I guess I'll pass it on to Dr. Zhang. I guess it's the timeline in between the 2 vaccinations dosage.
Right. We have to be careful whenever we say we don't have, real life information, we don't have trial data, because trial data takes time to collect, right? In order to study if something, you can do delay a vaccine by X amount of time, you have to have an X amount of time to actually study it and compile the study, collect the data, analyze the data, publish it. So those type of things take time. So I'm not surprised that right now we say there's no large trial to support this. Well, because we haven't had the time to look at it. But what we do know, both the Moderna and the Pfizer vaccine, is that there is data to support that they're efficacious even after 1 dose. So I think the Pfizer vaccine was quoted about maybe up to 70% effective after just 1 dose. And then Moderna was even higher, 90% after the first dose. So we do know that they infer some protection even just after 1 dose has been given. And when it comes to the AstraZeneca vaccine, even in their original trial, there were patients who had intervals between the 2 doses beyond 12 weeks. So that has been included in the study data. I do see the concern, and I understand completely where it's coming from, because we don't have that robust, typically what we think of as robust data to say this is effective. We have some indirect data to kind of support that this is most likely going to be better than not having the vaccine, to say the very minimum, and that is probably going to infer a significant amount of protection, actually, even after that 1 dose. Like I said earlier, we are expecting NACI to release maybe some information on how they arrived at their decision, so there's some transparency so that the public can understand how this decision is made. But, during this pandemic, everyone is pretty much flying a plane as we're learning how to do it, because there's so much unknown. And we're doing what we think is best practice in the time and in this environment that we're operating in. I'm not able to completely alleviate your concerns about that, because that is a legitimate concern. But hopefully you feel a little bit reassured with my answers.
Thank you, Dr. Zhang. And I know that that you'll also, in terms of our health networks, will update us if there are things that we get, any information we get based on the vaccination as well, and the efficacy and effectiveness of the vaccines and the timeline in between. I also want to address, some folks are asking the difference between SHN and TEHN. So TEHN is the Toronto East Health Network, or Michael Garron Hospital, which covers the west part of our riding. So anything between Victoria Park and Warden is covered by that part by Michael Garron Hospital. And some of you received our emails and information in terms of when they're vaccinating, and all our information is on our website as well. And then from the east side, from Warden to Markham, that part of the riding is covered by Scarborough Health Network, which is SHN, and Dr. Zhang and David are here from Scarborough Health Network. So great question, and this will be available later on our social media, so you can go back to the presentation as well, if for those of you who are wondering. Sorry, go ahead, Maisha.
No worries, thank you. We have two questions around the same topic, so I'll read off both of them. Can you address the suspensions of AstraZeneca vaccines in some countries after blood clotting complications that occurred in some patients? Was that merely coincidental? Does the NACI study that sort of situation? Second question, once again, is AstraZeneca safe? Some European countries have paused it.
I haven't seen anything definitive. These are all coming out really rapidly from, news outlooks. I haven't seen anything definitive to suggest that there is a causal relationship between the vaccine and the blood clots. Could there be a correlation because of how many people were vaccinated using AstraZeneca, and then subsequently you found that people have blood clots? Possible. I have read in the news that the EU medicine regulators, the EU Medicine Agency, have said that there's no concern or no indication that the vaccine has caused these conditions. So it's an ongoing, it's obviously an ongoing issue that is unfolding. But with any sort of vaccines, when you're vaccinating vast number of people, there will be people who incidentally develop things that may or may not be related to the vaccine. So in Ontario, we do have a mechanism for reporting vaccine-related adverse effects. So for anybody who thinks they're experiencing a vaccine-related adverse effect, they can submit a form to the local public health unit, and this information is constantly being looked at. Obviously, the data up to date that we have collected locally are largely on the Pfizer and the Moderna vaccine. And we really haven't seen that many serious adverse events associated with these vaccines. Most are minor, and I really haven't seen anything super alarming or significant. And I do believe that the local public health units are monitoring vaccine adverse events being reported, and subsequently these reports will go back to Health Canada as part of the post-marketing surveillance.
Thank you. How long the rollout for general public to get vaccinated? And the second question from the same person is, why are healthy 64-year-olds being vaccinated before oncology patients?
So this one, I'm hoping, David, you might have any answer in terms of the middle range that were asked to go vaccinate. Do you have any information from that?
Unfortunately, I don't. We're going by the guidelines that are provided to us by the ministry and by the government. So I unfortunately don't have an answer for why, when, and who right now.
Maisha, what we can do is, and for the constituent who's asked us the question, I will make sure that I let the minister know that you're asking about the priority, and how people are being prioritized should be also explained. And this is something that I will make sure that I take to the legislature.
Thank you. Is there any information available about the next vaccine supply and how many SHN will get in the future, since appointments have been paused for the moment?
Yeah, absolutely. Oh, Yep. Sorry, just need to check if I was on mute. So appointments haven't been paused right now. I just want to reiterate that we're constantly opening up. We're opening up slots. In terms of the way that it works with, we get a schedule of what the anticipated supply is going to be delivery for the next couple of weeks. But those figures and those information, as you can understand, changes because it's very hard to predict out what's going to be next week, let alone in 2 or 3 weeks in terms of supply. So that's especially since there's going to be such an influx that's coming in March. So we do have estimates. How realistic those estimates are, I think they're based on current supply numbers.
Okay. How is the province notifying seniors about their eligibility? Which I understand is a question for the province, but if you want to address that.
This is a great question. I don't think that folks are getting notified per se. David, is there anything that you guys have from the health network? I don't think so. What we have tried to do from our office is inform everybody within Scarborough Southwest to let you know that if there's anyone who's within that category that qualifies right now, is on the priority list, then you can get vaccinated. Especially for seniors, we've tried our best to kind of give as much awareness of this information, and we're hoping that you can support us by letting us know if there is anyone that's in your household, your neighbor, and we have actually had a lot of people who reached out because their neighbor is an elderly and should get vaccinated. So help us promote and create awareness about the information within the riding, and we've asked for the government to have a comprehensive plan that people are aware of, and something that I will continue to do within the Ontario legislature. But that's a great point, and thank you for that.
Can people in your riding try registering on the SHN site, even if they have registered on the TEHN site and have not received a reply?
Theoretically, yes. Realistically, yes. Is it encouraged? No. But there's nothing stopping people from doing that. But the only thing I would caution is that the more people that do that, the more slots that are going to be taken up for non-appointments. So it just complicates things for everybody if everybody does that.
So David, a follow-up question is for folks who are wondering about that. Are people able to cancel their registrations?
At SHN, yes. I don't know at how it works at other hospitals. And I don't know how it's going to work with the provincial system that's supposed to be launched next week.
Okay. And I think Dorothy was asking about that. That's a great point. So when I said the border, it's not really stuck to those border. I mean, the hospitals treat folks in different parts, and in soon we will have, I think, Warden Hilltop and few other places where we'll have mass vaccination centers that will be facilitated by different health networks. So they'll be working together in different parts of our ridings, and I hope that you can get vaccinated there. But I'm going to actually check if there's other places you can cancel registration, so that in case you're finding the opportunity to get it, then you can go ahead and cancel it, so that other slots open up for others around the neighborhood. And then there's also pharmacies and, like, for example, I think Freshco and Costco, Walmart, and other pharmacies that are giving out vaccination. We have the ones in our riding on our website as well.
Thank you. My husband will be 80 in June and is very vulnerable due to PD and diabetes, to name only two. How does he get priority?
If he's going to be 80 in June, he can come right now and get vaccinated.
So he should be able to go on scarbvaccine.ca and get registered?
Yeah, not a problem. He can come and they will give him the vaccine. We're not, if you are 80 in June and you've went through the last year, you can bet that we will be giving you that vaccine.
Thank you. I see that Pfizer is approved for 16 plus of age. However, Canada is only vaccinating 18 plus. Are our kids at risk? I have teenagers and I want them to be vaccinated.
Dr. Zhang, do you want to take that one?
So yes, Pfizer is approved in people age 16 and above. We do expect there to be more pediatric data coming out in the summer from the main vaccine manufacturers. Moderna and AstraZeneca are for people 18 plus. These distinctions are made because this was their inclusion criteria for the trial participants. And as with any medications that comes out onto the market, any pharmaceutical product, we want to protect our kids, so they're studied often later compared to adults. I would expect there would be more data coming out about the use of these vaccines in the pediatric population and subsequently followed with Health Canada approval in the age categories. But having said that though, even if they're approved today, they will have to wait their turn. And we're still going by the algorithm that's set up by the Ministry of Health, targeting the most vulnerable groups first.
We have a number of questions about this, so I'm going to only read out one. What about the Moderna and Pfizer vaccine make them safe? There are a few questions about the safety, about the Moderna and the Pfizer vaccines.
The safety of any pharmaceutical product, if they're to be approved, are being examined very carefully by Health Canada. That's their job, to make sure that any pharmaceutical product that's approved in Canada are safe and effective. And it would not be approved onto the market if there is not sufficient safety data. Like I said earlier, provincially, we collect vaccine adverse effects, and we have been collecting since December of 2020 until the latest report was March the 6th. And in this time frame, there were 600 reports of adverse events after almost 900,000 vaccines being administered. So that gives you an idea of how rare vaccine adverse effects are. And about 98% of that 600 something reports are considered non-serious, meaning maybe it's a skin reaction, a sore arm, pain at the injection site, maybe people had fever. And there was only 14 that were defined as serious. So some of them may be managed as a severe allergic reaction, for example, which we do know can happen, but very rarely so. So I hope that gives you an idea of how safe at least these two vaccines have been that we have been administering mostly in the long-term care setting as well as for healthcare providers since December.
Dr. Zhang, can I ask a question about mRNA vaccines? Why is it that have there been mRNA vaccines in the past, and if not, why haven't they been put out into market and everything? So is this like the first time that mRNA is being used?
It's the first time it's being used for vaccinations, is my understanding, but it's not a new technology. And for any time there's something new, there's always concerns about safety. But if you go back to the basic scientific principles and look at what exactly is in this vaccine, it's really just a recipe that tells your body how to make this protein. That's it. It doesn't insert itself. It doesn't go into your cell's nucleus where the genetic material is hosted. It doesn't even go there. I know on the internet, there's a lot of people being concerned about it altering your genes in some way. Well, it's not possible because it's an mRNA. And all it has is a lipid particle, a nanoparticle that is protecting it to ensure that it gets into the cell. And your cell transcribes this recipe into this protein so that you can elicit an immune response against, and the mRNA is quickly degraded. So that's the mechanism at which that works. As to why it has not been used in vaccines in the past, I don't have a good answer for that. Has there been, maybe perhaps there hasn't been as great of a need to make a vaccine and make it available, at the scale in the last decade? Possible. I'm not sure. I would be speculating, and I would not be addressing that.
Thank you. I don't see Indigenous adults on your COVID phase approach. Will we be including Indigenous adults in the rollout plan?
Yes. Oh, absolutely. So Indigenous adults should be able to register right now who live in Scarborough. But also we did a town hall for the Indigenous community in Scarborough specifically with some of our experts last Friday. We're going to be doing a pop-up testing at Native Child and Family Services of Toronto on Kingston Road next Wednesday for the community. And as well within the next, I would say, 2 weeks probably, we're also going to be doing mobile vaccine clinics in specific congregate care settings for Indigenous adults as well.
In the second group on the slide about the rollout, there was the over 75 age group that was mentioned. Someone has asked, is over 75, does over 75 mean that if they are 75, they're not eligible?
I would believe 75 would be included in that, yes.
Thank you. Are people being tested for antibodies against COVID-19 before they're being vaccinated?
No, we're not doing testing before vaccination. And maybe, Dr. Zhang, maybe you could talk about people that have had COVID maybe over the past year. Should they be getting vaccinated? Is it worth it for them?
That's a great question. Thanks, David. So based on the NACI guidance, people are definitely eligible to get vaccinated even after they have had a COVID-19 infection. And the reason for that is because we do know that your immunity after you've obtained a natural COVID-19 disease will decrease over time. So the vaccine is actually able to elicit a pretty strong immune response even after you've had a COVID-19. I'm just trying to see here if I can get the numbers for you. In those who recovered from COVID-19, a single dose of mRNA vaccine appears to provide the same degree of protection or more compared to 2 doses of vaccine, those with no history of infection. So this was a study that I just read today to basically say, if you had an infection before, maybe you only need 1 dose. Obviously, that is not something that's been adopted and recommended, but there is definitely no contraindication, no reasons why you shouldn't get the vaccine, even if you had COVID.
Thank you. Do I need vaccines, regular vaccines against the flu after taking the COVID-19 vaccination?
Yes, it's a different virus. So the vaccine it's not going to help you, it's not going to protect you against the influenza virus.
Thank you. We have questions about how long is the vaccine for health compromised people?
How long?
So how long is the wait for the vaccine for health compromised people?
So for SHN, we're not doing immunocompromised or health compromised people right now. We're only doing those 2 categories that I showed. But according to the announcement that I heard yesterday from the government, some of the pharmacies and some of the primary care that have AstraZeneca are doing 60 to 64, and they're also doing people with those pre-existing conditions. But I don't have much information about that, unfortunately.
I'm just going to chime in. I mean, if you look at the phase 2 rollout chart that David has shared earlier, if you're immunocompromised, then really it's probably due to a chronic health condition. You probably fall under one of those chronic health conditions. And at the expected timeline based on the province's plan, it would be April.
Thank you.
Yeah, I think a lot of the questions we're receiving are about timeline, and people are anxious to know when they can get their vaccination. So the doctor saying that helps, and I think we have in our community, we also have a lot of essential workers who are more exposed, and we have a lot of multi-generational homes where, from grandparents to parents to grandkids live all together, and that means that someone's going to high school, parents are going to work, some of them may be healthcare workers, and then we've got the grandparents who are elderly, and obviously if they have any immune compromise conditions, then it's a tougher situation for those households. I can promise you again, for those of you that we're going to keep asking the government to at least help us understand better when people can be expecting to get their vaccination, so they have a little bit of hope and an understanding of preparation for when they can get their vaccines. And also it's a smoother rollout as well, because I'm looking forward to Monday for the province to put out their portal, but I also know that everyone's going to jump on the portal, and I hope things go as well, but it's going to be tough, that load to go all at once. So we'll let you know as soon as we find out for that age group. And I think Maisha, do we have more questions that are similar that we may be able to answer as well?
A lot of our questions are about COPD, pre-existing conditions, and when vaccines will be available for those who have pre-existing conditions. So, yeah.
Is there, Dr. Zhang, do you have any recommendations in terms of what do you foresee or hope that it looks like in terms of folks who have, chronic illnesses?
Well, I hope that the province is able to stick with their established phase 2 rollout, the timeline that they've been provided, that they provided the public, so that the people with chronic health conditions are able to get vaccinated in April. I also hope that the government can give us a little bit, or the Ministry of Health can give us a little bit more clarity as to which chronic health conditions should be prioritized, because right now we don't have that information. And even within the categories of people with chronic health conditions, there are some that are more vulnerable than others.
Thank you so much. And April's about what, 2.5 weeks away, less than 3 weeks away. So I look forward to that very soon. But please check out the pharmacy locations as well on our website to see if you could find one of the available slots there if you're in one of those situations. Go ahead, Maisha.
I believe this will be our last question. What is the plan for primary caregivers to family members who are over 85 and disabled? Will they be included in phase 1?
Sorry, can you repeat the question? You broke up a little bit. Was that for me?
What is the plan for primary caregivers to family members who are over 85 and are disabled?
What is the plan for primary caregivers who are
family members, those who are primary caregivers to family members over 85? The family members over 85, they're the caregiver. What is the plan?
David, do you remember if they're on the chart or if there's a category of those?
Yeah, I'm trying to think of that, but I don't have an answer for that. But I could try and find out and get back to you to your office to provide that answer for that person. Sorry.
That's a great question, and thank you, David. Yeah, let us know. We'll make sure to post it on our social media, and if you emailed us, we'll make sure that we respond to you via email, because I do realize there is a lot of people who are getting vaccinated if they're within the age group of over 80, but if you are a caregiver of one of those individuals, then you're not really on the category yet, and you don't know when to get vaccinated. Essential caregivers specifically, who do an amazing amount of work, and my heart goes to all of you. Maisha, I think we've gone a little bit, actually a little over time. So I want to thank Dr. Zhang and David. Maisha, if we have a lot of questions left, what I'm going to ask folks is if you have other questions, please don't hesitate to leave us a comment on our social media or send us an email, and we will touch base with the hospital to get the answers. And if there's anything that we already have the answers to, we'll make sure to respond to you. I want to thank. Go ahead.
Sorry. We have one last question that came up, which I think, David, you'd be able to answer. Yesterday on the TEHN site, they had a category for 70 to 79. Today, that has disappeared. This is causing a lot of confusion to those who are trying to register. Is the SHN site clearer and more consistent?
Sorry, what site had 70 to 79?
On TEHN, they had a category for 70 to 79, but it has
I think that could have really been a mistake. I know that Sunnybrook also originally, when they put their thing up, they had 70 plus, and that was just a mistake. Nobody's doing 70 to 79 right now.
Thank you. And I believe that would be the last question. Thank you.
Thank you so much, Maisha. Folks, I want to just take a moment to also say thank you to my entire team who over the last few days have been working nonstop to do an amazing job answering your questions. We are getting an overwhelming amount of questions, phone calls, emails about vaccines. And I know, and I know you're frustrated, and rightfully so. It's been a tough time for people. It's been, many felt like they're left in the dark. And trust me when I say this, I have been raising these questions in the legislature, and I will continue to do so. And I will make sure that we're still fighting for priority as well as more vaccines to be given to Scarborough. My team is doing an incredible job. They created a guide for all of you in Scarborough Southwest to basically compile all the information we're getting from both Toronto East Health Network and Scarborough Health Network, as well as all the other locations that have vaccination in one place. So that's on our website, as well as making sure that you have, some details about what's going on and when you can get your vaccination. We'll put that and making sure that we have those details there, as well as the registration forms and links for those. And if you've missed the links, David has also given the link for SHN as well. David, do you want to tell us that one more time?
Yeah, it's scarbvaccine.ca.
Perfect. Thank you so much. And the Toronto East Health Network link, as well as the pharmacy links. So by the way, we have 3 pharmacies in our Shoppers Drug Mart, Rexall Pharmacies, Costco, and I believe there is one more. All of that is on our website, and we'll keep updating them as well, so that you can have those information and the time they're open. I'm going to end it here and say thank you so much. We'll try our best to do more information session as much as possible. I thank you. Have a good night and stay safe and healthy out there. Thank you so much, Dr. Zhang. Thank you, David. You've been wonderful, and this was really, really helpful for all of us in Scarborough Southwest. So on behalf of everyone, thank you.